Our next presentation is virtual by Professor Dr. Nabila Talat. She is the head of Department of Pediatric Surgery at the Children's Hospital and University of Child Health Sciences in Lahore, Pakistan. Her presentation is entitled Comparison of Outcome of Purse String versus Conventional Linear Wound Closure Technique in Patients Undergoing Reversal. So we'll bring that presentation up, please.
Good afternoon and greetings from Lahore, Pakistan. First of all, I would like to thank the APSA organizers for giving me this opportunity to present at this prestigious forum. I have nothing to disclose. We all, being pediatric surgeons, made stomas for a variety of reasons, and we all have the aim and intentions to reverse these stomas as early as possible without any complications. Still, we face problems like anastomosis leak and the surgical site infections. The cosmetic appearance of the scar is generally overlooked in our part of the country, where even access to the basic necessities is an issue for the patients and their parents, and what to talk about the aesthetics and the cosmesis. We conducted this study with the intention that closure techniques for the stoma's wounds does affect the complications as well as the sequelae regarding the scar. The two techniques of the purse string wound closure and the linear wound closure were compared in this study, with the primary outcomes to be observed are the surgical site infection and the scar aesthetics, and the secondary outcome as the hospital stay. This was a randomized controlled trial study conducted over the period of 1 year in the Department of Pediatric Surgery, the Children's Hospital Lahore, and the University of Child Health Sciences after the IRB approval. This trial was also registered on the Thai trial registry. 124 patients underwent this study, with 62 in each group of the purse string wound closure technique and the linear wound closure technique. Manchester Scar Assessment Scale was utilized for the evaluation of the scar, considering the parameters of the color, the finish, the contour, the distortion and texture, grading the scar from the excellent to the poor. When results were analyzed, both groups were comparable in terms of the mean age as well as the sex. The 124 patients underwent study had the variety of the diagnosis, with majority belonging to the anorectal malformations, followed by the enteric perforations, intussusception, perineal traumas, Hirschsprung disease, and minor percentages were belonging individually to the puff appendix and puff macle or the gut volvulus and necrotizing fasciitis, etc. 50% of the patients have to have the loop colostomy, followed by 40% loop ileostomy. Double bell ileostomy was made in 7%, and double bellar colostomy and bishop poop in 2% and 1%, respectively. Coming to the one of the primary outcomes observed, the Manchester Scar Scale assessment was done for the scar immediate at 2 weeks, 6 weeks, and 3 months interval. Both groups were compared in terms as the excellent, good, fair, and poor scar. In the group A, which was the linear wound closure technique, patient showed 20% as good. None was having the excellent scar, and about 50% of the patients were showing the fair scar and 30% with the poor outcome. Regarding the scar scales in the purse string wound closure patients, only 3% showed the excellent. More than 60% showed the fair, good to fair outcome, with the fair in 22% and 11% with the poor outcome. Wounds were measured at the time of the closure as well as after the healing. This was the pictures of the per-op, immediate closure, and at 1 week interval in the both groups. And one can appreciate the longitudinal and the horizontal dimensions of the both wounds with significant difference. Later on also, the evaluation was done for the linear wound closure technique, and you can appreciate that none had showed the excellent result, and good scar was appreciable as well as the fair scar. Poor scar was around 30% in these patients at later interval of 12 weeks. Purse string wound closure technique patients, 3% showed the excellent scar, But in this group, majority, more than 60% show the good scar followed by the fair and the poor scar as 11%. Surgical site infections were also noted, and more than 40% in the linear wound closure technique showed the infections, as well as the 15% from the purse string wound closure technique patients. Both groups were managed for their wounds according to their culture sensitivity patterns. Hospital stay was noted, but it found to be insignificant. When we reviewed the literature, we noticed that our study is comparable in terms of scar grading as well as hospital stay with the available literature, except for the one study conducted by Lee et al. In 2014, and they showed the significant difference in terms of the hospital stay as well. We concluded that the purse string wound closure technique is superior in terms of the linear wound closure technique comparison for infection rate and the cosmesis. But we believe that the multi-center study on the larger patient group should be done to adopt this study as a standard practice. Thank you very much, and I would happy to answer the questions.